So let's talk about some things that really do occur. Like if kids don't have a voice yet, right? Because you see them like we do when they don't in many settings, and they're having difficulty fitting in with peers. And so it's not just about talking in general or communicating rather in general. It's about all the things that happen throughout their life because they're not maybe able to advocate for themselves. They're very dependent. An example I give is like being able, like, for example, not being as accepted by peers, especially, because they're not able to verbalize yet. They're not able to communicate. Some of them not even non-verbally. What are some of the strategies you use or coping skills you teach them to deal with that, to build resiliency? Because it's, there's kids that get bullied.
I know. I see kind of two scenarios: the bullying, and then I become the assistant to the child I don't really like, but this child loves having somebody who's just following them around, and so I can't get to choose what we play or speak up if I don't want to do something or make other friends. Like, those are the two dynamics that I see the most. I try to first educate parents and teachers a lot to be very vigilant of these type of scenarios, but I also try to create like kind of like check-ins with parents and children where, like, every now and then, like, how are things going with this person, like, to make sure that the child is communicating at least to the parents about it, because we will have to intervene. If we wait until the child has a voice, who knows how much time is going to pass by. But, like, to make sure that adults are protecting a child if the child is in a place where they can't really, like, advocate for themselves.
Yeah, no. And being very strategic to buddy them up. Sometimes the kids, like you said, they'll bond with someone that talks for them and does for them. And as we're trying to build those skills and help them become a more confident verbal communicator, social verbal communicator, they don't need them as much. And that other person loses their role and they'll want to hold them even more. So I see what you're saying. We see this a lot. So trying to purposely buddy them up with other friends and having get-togethers with other friends so that they start to branch out and helping them realize, all right, that child may, because sometimes kids aren't treated nicely. I see this as they get a little bit older, or a friend or friends they had are no longer interested because they're interested in other things. So that causes them to feel bad about themselves. So dealing with this or teaching them to advocate for themselves, like self-advocacy and independence, is a big part of resiliency.
100%. And sometimes kids go to, like, for example, like at the Childman Institute, we have like Brave Bodies, which is like a group type of therapy. And so they meet kids who are struggling through the same. They can connect in a way where they don't feel so alone with their symptoms, right? It's like, I'm not the only one. And this child seems really cool. And this child has a hard time speaking as well. So that makes me feel better about myself.
Yeah, that we call that, as you know, social identity, to be able to connect with somebody else that's going through exactly what I'm going through, whether you're a parent or your child. It absolutely is. It's a beautiful thing to see too, when they do see that. And I always say progress doesn't happen in a group except for Communicamp, which is our intensive group, because they feel safe there. It's like, it's like they feel safe because, wow, they also are having a difficult time. And it's like, wow, we're all together in this, and it makes them feel better actually about themselves and willing to take risks.